The calls are growing louder for the Fort Government to address the closures of hospital ERs and ICUs right across the province after more than a dozen were shut down this past long weekend.
CP24's Arda Zakarian joins us live from outside of Queen's Park with more on this story. Good morning, Arda.
Good morning. About 14 hospitals around Ontario had to close down their ERs and their ICUs over this past long weekend because of staffing shortages. And while this is happening mostly in rural areas, major centers are having trouble getting nurses to fill shifts as well. They're suffering from a number of things, including burnout. So a lot of them aren't working. So there's a number of issues that we've been talking to doctors about this as well. Why this is happening, we'll have more a little bit later on in the show. But here's one ER ICU nurse.
For over 2.5 years, nurses have been working throughout the pandemic without breaks, and in terms of having vacations, nurses had vacations canceled. People have not been able to take time off. So right now, nurses are really tired and saying, you know what, I'm done. And the working conditions have not improved. They've actually worsened. People are actually working 16 hours just to sustain the system. I had to work 16 hours a couple of weeks ago because there was no nurse to take over my critically ill patient. And it's almost impossible to walk away in a situation like that.
I was speaking to one family doctor who says that there's also a lot more respiratory issues now. There's an uptick, not just because of COVID, but there's a lot more people suffering from respiratory illnesses, and that's taking up resources as well. So today, here at Queen's Park at 10 o'clock, Liberal MPPs John Fraser and Adil Shamji are calling on the provincial government, especially the Minister of Health, to do something about this because this can't go on. You can imagine how dangerous this is. Back to you.
All right, Arda Zakarian at Queen's Park this morning. Thanks, Arda.